My name is Beth Jewson, and I'm 40 years old. I teach at Wabasha-Kellogg High School, and I live in Wabasha, Minnesota. I have two sons, a 10-year-old and a 5-year-old. I've been teaching at Wabasha-Kellogg for 4 years, and I'm an English teacher in the high school. I was brought to Mayo Clinic with symptoms of bronchitis, which would not go away with antibiotics. So when I saw Dr. Nishimura, I was diagnosed with congestive heart failure, severe coronary artery disease, cardiomyopathy, high blood pressure, high cholesterol, all those things. From there, I was recommended for a pacemaker. Pacemaker was put in. I was released home. For 4 months I was home, resumed my normal activities, ended up with symptoms of what I thought was possibly another heart attack, returned to the hospital, consequently had a quadruple bypass, and since then have been leading a normal life with medication. Once my care ended at Mayo and I got home and of course was laid up for a while, as soon as I started to move around and become active, I felt good pretty quickly. Now the things that I do are take my medications as I'm supposed to. I have a restricted diet. I have a low sodium diet, low cholesterol. I follow that really closely. I can tell the difference when I don't. And my exercise my exercise program is improving now. I'm getting more confident about what I can do. I hiked to the top of a hill that was sort of the one thing that was looming for me that I was afraid to do. So it was the hill that I hiked right before I ended up in the hospital and with open heart surgery. So I was a little afraid of that one, and I just did that the other day. So I felt good about that. I remember when I was there and when I was leaving, the thing that really stood out in my mind was that not only were they taking care of the physical, they were also taking care of the emotional, and they were taking care of the spiritual. It was very nicely balanced. Things, all sorts of things. My stress level was always considered. Of course, my medications were considered. Being in intensive care really stands out. I think because you're in such a small space and you're so immobilized. I mean, you're really at the mercy of people need to care for you. You can't care for yourself. So that was very vivid. I mean, just the moments that would pass by, the night nurse that would talk to me. And I don't know her name, but she and I would, then there'd be just a dim light on, and she would spend her time talking with me at night when I was awake. That was nice. I remember that. I remember being nervous in my hospital room, and I remember Dr. Martinez coming in and sitting down on my bed and just taking right hold of my hand and sat there and talked to me for a while. There was a male nurse that I had that the second time I came back, he walked by the room and recognized me immediately. Came in, see how I was doing. He was really nice. It felt good that he remembered me and walked in and was checking. The women at the night desk, or on 4 Francis, women at that desk were amazing. They would screen my students, because I had a lot of students who would try to come and see me, and they knew when I was tired, and they would screen my students, and they would say, no, not right now. But then they would deliver the cards and they would deliver the flowers. But that was a relief to me, because and I love my students, and I was glad that they came to see me, but I was tired. Dr. Nishimura, I will never forget. Steve Amon, I will never forget. Jane Linderbaum, Dr. Hayes was very kind. Dr. Schaff, my heart surgeon. If I were a Mayo employee in the cardiology unit, I would be very proud. If you ever wonder if your job is valuable, know that people remember you, that your faces are in their minds, and that you've done a wonderful thing, that people will walk away feeling like you've given them their life back.